So we have these patients who are, lack of a better word, they are too fat. So you find their BMI is more than 30, or guys who are overweight, so your BMI is creeping between 25, 29. That's where you have your greatest risk of developing sleep apnea. And you see some of them just have a recent weight gain. So initially they were not obese, but then eventually they developed obesity. And the other thing is usually patients who are of the male gender.
Okay.
Yeah, unfortunately, males have a higher risk of developing sleep apnea. It's because once we start gaining weight, a lot of weight is, or rather, a lot of fat is deposited around the abdomen and some around the neck. So you find you're reducing the caliber of your airway. So a lot of fat is being deposited on your neck. And they actually said there's a measure you can close to 43, maybe at 42, 42.5, then there's a high risk you might actually develop obstructive sleep apnea. The others would be things, okay, at some point where now the testosterone is now causing you to develop obstructive sleep apnea. This is just because of, again, the deposition of fat around your neck. The other risk factor is usually, they talk of African race.
Is
Africans
it? I can't wait to
Asians.
hear why.
Yeah, but you see, sometimes those studies are skewed is because maybe they did a study on Africans, so they didn't do it really on whites and stuff, so some of the studies are skewed. Then, of course, we medics like blaming